Good morning, everyone, and thank you for joining us today, where we're going to provide an overview of a new opportunity provided by the Connecticut Health Foundation to integrate community-based organizations with healthcare providers. The webinar today, our presenters are Tiffany Donaldson from the Connecticut Health Foundation and Deborah Zahn from Health Management Associates. Just a few housekeeping items before we begin. This webinar is being recorded and will be archived on Connecticut Health's website for future access. All participants have been placed on mute upon entry, but we will open lines at the end of the webinar for Q&A. So to ask a question during that portion of the presentation, please feel free to either raise your hand by pressing the green yes button in your pane, or you can also type questions into the chat pane. You can do that at any point, and we'll just review those questions at the end during the Q&A, or you can save your question to ask at the end of the presentation. With that, I'd like to turn it over to Tiffany to provide an overview of the webinar. Tiffany?
Yep, thank you, Melissa. First, I want to echo Melissa's thank you for all of you who are joining this webinar. We at the Connecticut Health Foundation are excited to see the level of interest in this RFP related to integrating community-based organizations with healthcare providers. For our webinar today, we will be providing a background of our organization, the Connecticut Health Foundation. We'll also describe the request for proposal and give you more details. And lastly, we will discuss how to apply and provide, as Melissa alluded to, an opportunity for questions and answers. As Melissa noted, my name is Tiffany Donaldson. I am Vice President of the program here at the Connecticut Health Foundation. Our foundation is the largest health philanthropy here in the state of Connecticut. We are a statewide organization, and we started in 1999. Our approach to our work is that we provide grant making, primarily around demonstration models, research. We also do public policy research. We provide technical assistance and also convenings, all with the goal and purpose of improving the health of residents here in Connecticut. Our foundation from its onset has always been focused on looking at health disparities. And we, in particular, in 2013, started to focus more on health equity, particularly for populations of color here in Connecticut. Our work takes what we call a systems change lens to this approach. We understand that we are trying to approach health equity for the entire state of Connecticut. And when you think about healthcare, although we have some dollars to spend and to provide for grant making, it really is small as it relates to the total healthcare dollars here in Connecticut. So when we say systems change, what we are alluding to is changing the policies and the practices for how care is delivered here in Connecticut. Our organization focuses on looking at sustainable ways for us to address health equity here in the state of Connecticut. And that brings us to this RFP. As an organization, we recognize that most of what impacts one's health is outside of the healthcare setting. There is data that indicates that only around 10% of one's health is determined by what happens in the healthcare setting. And most of what impacts one's health is what we consider the social determinants of health. So that is where one lives, where one worships, plays, eats, learns, all of those things that we consider a part of our daily lives is really what impacts health. We have recognized this for a while as a foundation, and what we are focused on with this RFP is how do we effectively bridge the community-based organizations who are often addressing the social determinants of health. How do we effectively bridge those organizations with healthcare organizations? You're going to hear systems change throughout this webinar, and I'm going to allude to it again, because what we're looking for are sustainable linkages between those organizations. Deb Zahn is going to go into a little bit more detail, but overall, we're trying to figure out how can we make meaningful and long-lasting connections between community-based organizations and healthcare providers. Our end goal as an organization, and particularly as well with this RFP, is for us to see people of color here in the state of Connecticut to see that their health outcomes improve. We want to assure that all people of Connecticut have the ability to have their healthiest lives regardless of their demographics, and that health outcomes are equal, or the potential for good health outcomes are equal across all populations. So our focus, again, is on building the sustainable linkages between community-based organizations and clinical providers, and assuring that the health of people of color here in the state of Connecticut, to assure that the health outcomes are improved. And so with that, I'm going to turn it over to Deb Zahn, who is going to go into more details about this particular opportunity. Deb?
Great, thank you very much, Tiffany. And Melissa, if you could fix the slide quickly so they can see the whole slide. Okay, great, thank you. Sorry folks, a little technical difficulty. So the opportunity essentially, as Tiffany said, is to support having clinical care providers and community-based organizations integrate among themselves in up to 2 Connecticut communities. And in particular, the goal is to have those communities have significant populations of color. And the intent is for these new systems to be able to address sort of the multiple factors and the multiple inequities that are influencing people's health, and ultimately to be able to create something, a system of care and services that's more seamless and holistic. So the foundation is going to provide some seed funding to pay for some of the expenses of doing that, as well as some technical assistance, which I'll talk about in a moment. And what it's looking for is for a group of at least 3 community-based organizations in a community that have a connection to at least 1 clinical partner in that community. And the community approach is really key here, because instead of just having 1 CBO and 1 clinical partner link, the intent is to be able to make more change within that community and among service and clinical providers that actually serve common populations. So the funds and assistance, and the intent of those is to be able to support the readiness of the collaboration of CBOs in order to pursue those integration strategies, and then all the way through being able to implement those integration strategies with at least 1 clinical partner in the community. So it could be that it ends up being more than 3 CBOs, it could be an additional clinical partner, but at minimum it has to be 3 CBOs in a community plus 1 clinical partner. Next slide. So as Tiffany said, a central focus of the foundation's is health equity. And this is really an opportunity that very much is focused and intended to benefit people of color. And as Tiffany said, and you're going to again hear this a lot, it really does target the systems change. So the goal is not to use these funds and use this opportunity to create new services or programs, but it's really about putting the things in place that would enable the community-based organizations to be ready to, and all the way through implementation of the integration systems with their clinical partners. So it would be for things like doing and establishing shared assessments among the different entities, workflows, data sharing agreements, mechanisms for actually being able to share data, sort of all of that system work behind the scene that would actually make the integration strategy work on a daily basis. And that creating sort of the new ways of working among the partners and then having the systems underlying those to be able to support it is really a core sustainability strategy. And what the foundation will be asking of whoever the awardees are is to consider sustainability from the beginning, so that the decisions that you would make from a design perspective and an implementation perspective are targeted towards developing a sustainable integrated system. And that's why the systems piece of it is so critical. Next slide. So the grant objectives, and I'll go through, there's 3 phases of the grant, but ultimately, as we said, the goal is for the collaborative of community-based organizations to become ready to integrate, to be able to negotiate formal agreements with clinical providers. And the clinical providers could be primary care providers, it could be advanced networks, or it could be hospitals. And there's 3 phases. So the first phase is really focused on readiness. And we have time frames in here, but the one thing I would say about the time frames is some of that may change depending on who the awardees are. So these are estimates in terms of what it would take to complete each phase. So in the first phase is really focused on readiness among the community-based organizations to be able to design and negotiate an integration strategy with a clinical partner. So the first part, it would include things like assessing and documenting whatever best available data and information you have on, if you're a community-based organization, on the populations you serve. And this is really critical because clinical partners tend to think in terms of populations that they serve rather than individual programs and services. So this is really to be able to get folks on the same page so that they're speaking the same language during negotiation. It also would include developing a really in-depth understanding of your clinical partner, what their needs are, the populations they serve, and that would uncover opportunities to integrate as well as guide some of the design and implementation decisions. It would also include collecting data that actually demonstrates the performance and quality that is already being achieved by the community-based organizations. Again, important information to have at your fingertips while you're in a negotiation for an integration strategy. And then also to do things like to identify gaps in your systems and processes that would have to be addressed in some way when you were implementing. It would also include identifying and being able to clearly articulate the value proposition that the community-based organizations are bringing to the table, which again is a critical strategy when negotiating. And then the last piece is really the financial part, which is being able to clearly define what the financial goals are and the parameters that would have to be part of a negotiation with a partner. So the intent would be is that in phase 1, by the end of it, community-based organizations are ready and able and have all the information they need available to them to be able to start to negotiate in phase 2 and then ultimately execute a formal agreement with their clinical partner on a specific integration strategy. And the estimate is that probably would take 6 to 10 months. Again, that might change depending on who the partners are and what type of things they've already done together. And then the third phase is really where it's about implementation, where you actually develop and implement the clinical and community integration strategy with your provider partner. And again, the estimate there is that could take, depending on what the strategy is and who the partners are, between 8 to 12 months. So the intent of this grant is to get all the way through this cycle from readiness to getting agreement in place to actually implementing. Next slide. So I want to say a little bit about technical assistance. So as we mentioned, that there will be some funds that will be available to support some of those one-time expenses that you would have to actually be able to get some of this in place. But there will also be technical assistance. So the foundation is going to engage an external consulting firm who's going to provide that TA to awardees with the intent of helping them make sure that they can actually achieve the project goals. And it's going to be developed based on who the awardees are and based on what their particular needs are. But it will include things like training, educational materials, tools, templates, as well as some coaching. And given what we know in Connecticut and around the country about how community-based organizations and clinical partners have come together, it likely is going to include topics like this and probably others. So things like IT systems and data and measurement, and how do you actually, what do you have today versus what you need when you implement an integration strategy. So likely be some templates and some assistance related to the value proposition for community-based organizations and their services, as well as around the financial goals and parameters. Likely also some assistance about quality improvement and performance management in terms of what you have today, and again, what you would need under a integration agreement. And then also potentially some assistance around partnership negotiations and formal agreements, ongoing engagement of community members to inform the strategies and to provide input, which is an assumption of what, or an expectation of what the awardees will actually do. And there'll be some technical assistance available to support that. And then again, there may be other things depending on who the awardees are and things that they indicate that they need, or things that come up along the way that they might need some help with. Now, the awardees are going to be required to take advantage of these resources, but again, they're going to be geared towards whoever the awardees are and their specific needs, so it should be extremely helpful. Next slide. So I want to say a little bit before I turn it back to Tiffany about the decision-making criteria. So how is the foundation going to evaluate applicants? And it's going to be based on this, these 4 criteria. So the first is impact. So they're really looking for that there is a demonstrated community need, and there's a significant number of community members impacted, and particularly, as we said before, people of color. The next one is readiness. So I did mention that there is going to be work on readiness among community-based organizations to enter into these agreements, but the intent is that there should be some readiness that's already in place that would support being able to do this in the timeframes that we talked about. So they'll look at things like the strength of partnership. So for example, is there already demonstrated engagement and commitment among the CBOs and with the clinical partner? Do you really have a good understanding and awareness of what the needs and strengths and gaps are related to being able to be successful in this project? There's also, they're going to be looking at the proposed methods. So even though there are distinct phases and there's going to be some specific technical assistance, there's going to be a lot of room for the awardees to decide what their approach is to this. So they're going to look at the appropriateness and feasibility of what your project plan is and what you say your approach is going to be, as well as how you talk about the ability to actually be able to generate, pardon me, meaningful and measurable results. They're going to look at the qualifications of the staff and the partner organizations that are participating, and then any outcomes you plan to accomplish in year 1 and over the 3 years of the project. And then the last will be the budget. So the appropriateness of the budget request, they want to make sure that what you're proposing actually aligns with what the project activities are, and then look at it from the lens of impact based on the funds at your request and ultimately who you plan on serving from a client and patient perspective. And then with that, I'm going to turn it back over to Tiffany, who will go through some of the remaining details with you.
Thank you, Deb. As Deb has alluded in her phases, you can see that this is a 3-year initiative. The way that we approach our work at the foundation is, while we are committed to organizations oftentimes for more than 1 year, we do require that there is an application submitted each year. This gives us an opportunity to take a step back and to assess how the year has gone, and then to determine the appropriateness of us continuing to fund. And most of the time, again, I would say 95% of the time, the foundation is committed. However, if we recognize that there are some significant issues that have gone on with a particular project, it gives us an opportunity to assess that. So applications will be due every year. The funding for year 1 is up to $75,000. And again, we will see progress in years 2 and 3 and determine the funding based upon our assessment for the outgoing years. as part of the application process, we are asking for 2 stages. We are first asking for a concept paper. This concept paper is only 5 questions and approximately 2 pages. This will give us an idea of what your proposed projects are, and also we as a staff like to work with potential grantees. So this will also give us an opportunity to flesh out your project more and to work directly with you if we feel like your project should advance to full proposal. If your project does advance to full proposal, you will see that proposal. We will make it available to you on our grants database system called Flux, and that grant application will be made available to you. That application is more detailed, obviously, compared to the concept paper, and the full proposal will include everything: your project narrative, your proposed methods. We always ask about culture and linguistic competence, your work plan, and I want to highlight also letters of support. Deb alluded to the fact that the collaborative of community-based organizations need to indicate that there is a relationship with a clinical partner. And one of the key letters of support is going to need to be and required to be from one or how many clinical partners you plan to engage with. So that letter of support is our way of knowing that you have a clinical partner who is there and who is willing to work with you throughout this process. Just a bit related to the timeline, I alluded to the fact that we have a grants database called Flux. You can register for Flux and get your login information by going to the website that you see on this page. And again, this presentation will be made available immediately following this webinar. Concept papers are due April 24th. We are going to filter through those pretty quickly, and we'll let individuals know early in May who is being invited to submit a full proposal. Full proposals are due May 31st, and we will be doing site visits in mid-June. And those site visits will include myself and Deb Zahn, as you have heard on the phone, and we will be doing site visits for those who have been invited for full proposal. And we will be doing notifications by September 26th. And just so you all have an understanding of our process, we will also, as a foundation, share your proposals with our board, and they ultimately have to approve your grant applications. Thus, the timing for us to notify you at the end of September following our board meeting. And now we'd like to open it for questions and answers. I know that we went through a lot of information between Deb and I. And so we do want to give you an opportunity to ask questions. I know Melissa is going to unmute line, so I would just ask that if you are not asking the questions, please make sure that your phone is muted. I also want to highlight that it's often challenging sometimes for one to ask a question in a large webinar setting, and we recognize that. So if you have any questions that you did not ask or don't feel comfortable asking in this session, again, please feel free to use the text box, but also please feel free to follow up with me following this webinar. And so with that, I do want to open it up for any questions.
Great, thanks Tiffany and Deb. And as I mentioned earlier, if you would like to ask your question, please just click on that yes button over by the participant list, and I can unmute your line, or feel free to enter your question into the chat team. So we do have one question. The question is, can you please define what is meant by significant populations of color?
Yes. So we are typically looking for the catchment area to serve at least 35 to 40% population of color in the catchment area that your grant will be, in the population that your grant will be serving.
Okay, great. We have a second question. Is there a geographic designation for communities, or do you have any preferences for what communities you're hoping that applicants will cover?
We don't have any preferences at this time. Again, we are hoping that we can get communities that serve a large population of color. We don't have any designation per se in how we define a community, but I would say that we are looking for a community or geography that is in a particular catchment area. So for example, we do not want to see a collaborative that is Hartford, New Haven, and Bridgeport, because that isn't necessarily a community. However, there could be a community, meaning a collaborative of community-based organizations specifically in New Haven or specifically in Bridgeport. So that's what we mean by a community, meaning that it has to be a particular catchment area within the state and not spread across the state related to the collaborative of community-based organizations and the health system that one is working with. Again, we don't have any particular communities that we are targeting or have in mind. We are really opening this up.
And this is Deb. I would also add for rural communities, recognizing that there might be community-based organizations that work across towns, which is a very different scenario than some of the suburban or urban areas. And I think Tiffany would agree that as long as the definition of the community as you define it makes sense, and that makes sense in your setting, and you also have the relationships and other things in place that would support it, that would be wonderful too.
Great. At this time, we have one new question come in. Are there any particular strategies or best practices you're hoping to see in the application?
Deb, I'll let you get started with that.
Yeah, what I would say largely the primary best practice is the emphasis on systems. So it's not a particular off-the-shelf model that would particularly be implemented, but it would be that systems approach and thinking through how you actually, with data, with workflows, and with other things, actually put together how the connection happens, and from a patient and client perspective, to create that seamless system across. That's really at the top of mind in terms of what the best practice would be, is to emphasize those things.
I would agree with Deb, and I was turning over to Deb as well because, her organization has done this work nationally, and it's difficult for anyone to define what a best practice is for clinical community integration at this point. And so it really just depends on what is needed for your particular collaborative and for your healthcare provider partner, what is needed for you all to create sustainable linkages that will last multiple years.
And the other piece that I would add is to create that from the perspective of how it impacts the clients and patients within a community. And so that's one of the things that we would be looking for, and that's one of the things that there would likely be some assistance around, is how to make sure whatever that system of care that's being developed, that integrated system, actually can clearly demonstrate that it's achieving the impacts you're trying to achieve.
Okay, I'm going to combine two questions. One, what started with, could you define clinical partner, clinical care partner again? And can an organization serve as both a CBO and a clinical partner?
Deb and I are not in the same room, so we're going to verbally take this on. Yeah, we're going to tag team again over the phone. But, you know, as Deb alluded to, we can define a clinical partner as any typical healthcare provider, hospital. It can be primary care providers. You know, we have some large primary care provider groups here in the States, as a ProHealth and some other large groups. So when I say, and let me go back to my first point, when I say a typical provider, you know, one of the major healthcare systems or hospitals here in the state, we would define that as a clinical partner.
And it could also be there, you know, again, we mentioned the advanced networks under the state's, you know, PCMH plus model, but it also could be an ACO or other types of collaborations among clinical providers. We also recognize that there are some clinical providers that also provide CBO-like services. So you may have a behavioral health provider that is providing clinical services, but also providing housing. Again, in the concept paper, I would suggest if there is a scenario like that, describe what you think the approach would be and make the case for it, and it would certainly be considered.
Okay, we have a question about how this initiative is connected to the state SIM initiatives, including health enhancement communities, the SIM community clinical integration program, and also the state prevention services initiative.
Tiffany, would you like me to take that one?
Yes, I want to let Deb chime in. I just will highlight for all of you that Deb is very involved in a lot of the SIM work related to the health enhancement community. So I'm going to turn it over to Deb, and Deb, I will add in as well. And just so you all have context on this webinar as well, the foundation is also very much integrated into the state innovation model and represented on a variety of committees, and we have supported it from its onset. So we're doing our best to align all of our work. But Deb, I'll let you take it away.
Great. So there's three main, I would say probably 4 SIM initiatives that most relate to this. So the one that is the closest to this is the Prevention Service Initiative, which our firm, Health Management Associates, also assisted with. And actually will be taking a number of lessons and tools that came out of that. But that was an initiative focused on diabetes and asthma that was specifically to develop contracts between clinical care providers and community-based organizations. So that was a little bit different than this in that this is focused on community-based organizations and clinical providers in communities, and that was sort of more a one-to-one approach. But the intent is that there would be a lot of lessons that would actually come out of that, and it may also be an opportunity for those that were involved in that process to be able to apply to this to essentially be able to take it to the next level. So that's the one that's most closely related to this. The other one is the Health Enhancement Community Initiative, which we're also involved with. So this is this initiative that the foundation is working on is more related to ensuring that the good work that community-based organizations are doing, which they may be doing ultimately when health enhancement communities come into existence, is connected with the work that's happening in a clinical environment. One of the things that we heard when we were out working with existing community collaboratives and talking to stakeholders with the Health Enhancement Community Initiative is, although that's focused on upstream prevention, there's a number of folks in the community that actually need prevention and treatment, and that we want a way for that to be able to happen. And this initiative is one of the ways that it creates the linkage between those two. So the vision could be, if there's a health enhancement community in a particular community, that they may work on certain aspects of prevention. They may have things like, home visits or working on housing initiatives, and that this is one of the arrangements that actually links it back to clinical care. So it's not an overlap, it's probably more like a Venn diagram, so that you would actually have that connection in the middle, and then either side of that, working on either more of the community health side of it versus the clinical side of it. And then the last one, or the last two that relate to it, is the primary care modernization initiative, which again, it's like the health enhancement community, still in the design phase. And that's really trying to bring sort of an advanced level of primary care and primary care teams to be able to actually have more funds and do more and have more flexibility to how they deliver care in a primary care setting. But that does envision that there would be community linkages, particularly through things like community health workers, which is the fourth initiative that Sim has been working on. And again, that could very much relate to this in the sense of, once, these primary care modernization comes into existence, because right now it's still in design phase, you might have the clinical providers that are part of this participate under that initiative, and they would be in really good position because they would already have these linkages in the community setting, which they're going to need ultimately to be able to achieve the results that they would have to. Health enhancement communities, primary care modernization, those, as I said, don't exist yet. They're still in the design phase, but again, the vision could be that they would be linked to what those would ultimately do, but that this would give you a really good head start in some of that work.
At this time, I'm not seeing any additional questions. If you have a question, please feel free to enter it into the chat pane. We'll be happy to answer it.
And Melissa, we could also unmute everybody in case anyone wants to ask a direct question.
We could. I'm not seeing anybody raise their hand to speak, and I've been checking, but I could unmute the lines. All right, so I'll do that now. Please, we'll just give you a moment. If you do not have a question, please put your own line on mute. Before I unmute everyone. Okay, here we go.
So much for that experiment.
Okay, never mind. I muted everyone again. I'm not sure that's going to work out. I prefer people just raise their hand and indicate if they have a question. That way I can unmute your individual line. So far, I'm not seeing any more questions. Oh, we had another question come in. Oh, I think we addressed this earlier. Can a clinical care partner be the lead agency? Or actually, we didn't address that specifically. Deb or Tiffany, you want to address that? Oh, I'm sorry. Whenever you muted everyone, I muted your lines. Hold on. Let me unmute Deb.
Organization?
Deb, I'm sorry. Deb, could you start again? I'm sorry, you're on mute.
That's fine. So the question was, can a clinical provider be the lead? And Tiffany, did you want to answer that, or would you like me to?
I think you had started when you were on mute, so go ahead.
Thank you. So the intent is for it to be a community-based organization as the lead applicant, but having a partner who's a clinical provider. However, we mentioned earlier the scenario of there might be a community-based organization that is also a clinical provider reverse, and I will let Tiffany answer that part of it, but the overall intent is for a community-based organization to be the lead on behalf of the partners. If, for example, you had 3 or 4 community-based organizations, they would have to pick one, and that would be who the lead is, and then they would indicate who their clinical partner or partners are. But Tiffany, what advice would you give folks if somebody is thinking to be a lead applicant who is both a clinical provider and offers CBO type services?
So I would say in that instance, again, and I am going to go back and give a little bit more history. So the foundation contemplated whether or not the applicant should be a clinical provider, for example. And we really leaned towards community-based organizations based upon us seeing the need of community-based organizations to really be ready for true integration with clinical partners. And when I say seeing the need, we've also heard from community-based organizations around capacity, around being able to receive and share data. And so we really wanted to make sure that we were supporting community-based organizations in this integration process, understanding that a lot of clinical providers they're already receiving data, they're prepared, a lot of them are prepared for some of the capacity, they already have the capacity that we see community-based organizations might be missing. So in that instance, and again, highlighting that the application needs to come from a collaborative of community-based organizations. So there has to be 3 or more organizations that are a part of this application. I would lean towards the side of the organization that may be providing both clinical services and providing some social determinant services. I would lean towards the side of them being a part of that group of CBOs, but maybe working or allowing another CBO to be the lead applicant, as Deb, I think, a bit alluded to.
A question came in, how much of the funding can be used for personnel costs?
Well, as a foundation overall, we do not provide direct services in any of our grant making. And what we mean by that is that we are not anticipating that we would fund a brand new resource that would only be for this project, and once the project is over, that resource will be gone. That is not what we want to see. However, we know that this project is going to require personnel to support it. And so we don't necessarily have a limitation on how the money can be allocated to the personnel who are supporting the project. I will also mention that we provide, related to indirect costs, that we typically apply around, I would say, 10 to 12% for indirect project costs in most of our projects.
Are there other questions, Melissa?
Not as of yet. We're caught up on the questions, but if anybody has a question, please feel free to enter it into the chat pane.
I think at this point, seeing that there aren't any more questions or not seeing any hands raised, I think at this point we can end this particular webinar. But as I alluded to at the beginning of our Q&A session, if you do have questions, please feel free to reach out to me, and I will loop in Deb, as she well knows, and both of us are more than happy to answer any particular questions. I also would say that, again, we are going to very much use the concept papers as a starting point for us to begin a dialogue between potential applicants. So please feel free to ask us questions before the concept paper period, but also know that we will also be looping back following the concept paper period so that we can continue an ongoing dialogue with those who are potential applicants. I just want to thank all of you for joining this webinar and again for your level of interest. We are excited as a foundation to be delving into this work, and we are really hopeful that we will engage new and wonderful partners through this RFP, and we are hopeful that you are interested in partnering with us around this really critical work to address the needs of populations of color and ensuring that our state is healthier overall. So I just want to thank you all for joining this webinar, and I look forward to hearing from many of you.
Thank you.